Good morning, everyone. I'm Dr. Haripriya, anesthesiologist by profession and presently working as a ECLS coordinator in Jeevaraksha. So, with this set of slides, let's all learn about infection control and safe transport of patients who are COVID positive and require transport to different places. Infection control is a very important part of containing the infection and spread of COVID-19 to different places and people. So to ensure this, we have administrative, environmental and engineering control. Our primary goal here is educating the community about infection control, like use of masks and maintaining social distancing and use of sanitizers or recurrent hand washing when we come in contact with patients who are suspected to be COVID positive. One more thing is disinfection of a high contact surface, whether it be in hospital or in the home setting. And triaging areas like in the hospitals or in high contact places need to have barriers using glass or plastic, and to ensure that all the windows in the hospital settings, especially in the reception area, is open. And the staff must regularly monitor themselves for any symptoms of COVID-19 like cough, cold, fever, or any kind of chest discomfort, breathlessness, so that they are identified early if they have infection and isolate themselves in a room so that they don't spread the infection to other people. So how do you uh, ensure infection control? One thing is uh, to decrease your visits to hospital. So what you can do is to have telehealth and telephone triaging, and for initial screening and for admission, which can be prioritized using telehealth and telephone triage. And infection control at home, you can use masks, hand washing and isolation. So these are things which should be followed by a patient who is COVID positive, and ensure that he does not spread the infection to other people around him. So what do you do at the hospitals? So in the hospitals, we come in contact with patients who are COVID positive and can easily be exposed to the droplets they are producing while coughing, sneezing or talking. So we have to ensure using surgical or N95 masks and wear a gown which can cover the whole of our body from the neck till the toes, and use gloves and use goggles and face shields. So this will ensure complete protection of yourselves against the infection. And whenever the patients are admitted in the hospital, we have to try to give them a single room, and with the present scenario it might not be possible, and in such situations at least 1.5 meter distance between each beds should be given, and the curtain drawn between two beds. So while working in the hospital, the same PPE should be used from the start of our duty till the end. The gloves can be changed how many ever times you wish to, and ensure hand hygiene either by hand washing or use of hand sanitizers, that is alcohol based hand sanitizers. When the whole duty is finished and you're coming out of the ward, then remove all the PPE as per instructions according to the doffing protocols and exit the ward. So as far as possible, when going from one room to another room, it is ideal to change PPEs. But in a single room, when there is a lot of patients in the same room, the same PPE should be kept. So this slide gives us the donning and doffing of PPE bit. So these links will be provided in our YouTube channel, so you can always go to the particular link and educate yourself regarding the donning and doffing of PPE. So in the hospital, as far as possible, please please try to avoid aerosol generating procedures like nebulization, or if it can be high flow nasal oxygen as well, which is a aerosol generating procedure. We are not saying to completely avoid it, but whenever we are having any aerosol generating procedures, make sure that we take adequate precautions. So nebulization, yes, avoid it as far as possible, and suctioning, while suctioning, to ensure that you have adequate precautions. So if you have to do any aerosol generating procedures, then use of N95 mask plus level 3 PPE plus goggles is very much essential, and we have to ensure adequate ventilation and all the windows to be opened so that there is cross ventilation and decrease in viral load inside the. So what should we do if there is a breach in a PPE? First thing is remain calm. Always remain calm. So there is no need to panic or become agitated about the breach in PPE. So there can be breach either in the gloves which you are using, or the gown, or the shoe covers which you are using. Do not panic. So if there is a breach in glove, so immediately disinfect the glove with disinfectant, that is alcohol based hand rub. Remove the outer glove and discard it into the infectious waste container. Next, disinfect the inner glove with disinfectant wipe or alcohol based hand rub. Inspect the inner glove for possible breach. If there is no breach, then allow the inner glove to dry for a minute and replace it with outer glove, which is a clean pair. But if there is a breach of the inner glove as well, report it to the team leader. So if then after reporting to your team leader, if it is required, please go and do an emergency doffing. What if there is a breach in the overall PPE which you are wearing, the gown or the shoe cover or your hood or something like that? So always go to a designated doffing area immediately. Remain calm and work slowly through each step of doffing. Remove PPE and avoid self-contamination as much as possible, because that is the most important thing while doffing. If exposed area is an intact skin, then wash it with soap and water. But if it's a mucous membrane or a eye or one of your eye, flush the area with generous amounts of water, and throughout the procedure, please remain calm. And if there is a percutaneous injury while drawing the blood or doing any procedures, do not squeeze the wound or soak in disinfectant. So wash the area with soap and water. Immediately report the breach to the higher authorities and continue your doffing. So till now we spoke about how to don, doff and control the infection at a home and hospital setting. In hospital, one more important thing is our visitors. So what do we do to our visitors? We need to have a clear-cut visitor policy in the ward, that is a general ward with more number of patients, also in a single room setting. So this set of instructions to the visitors should ensure that there is masks, which they wear it every time and every minute they are inside the hospital, and maintain social distancing at least for 6 feet, and they have to maintain a safe physical distancing from the receptionist window as well. We have seen many people peeping into the plastic sheets, which needs to be avoided, and educate them regarding it. And we have to have a team of housekeeping staff throughout our facilities who are focused on cleaning and sanitizing the high traffic and high touch areas. So we have to make sure the visitors do understand the hospital policies and follow it accordingly. So let's come to transport of patients. How do we transport the patient from one place to another? May it be in the hospital setting or to another hospital or a COVID care center or a ICU setting. What are the scenarios which require a patient transfer? One is hospital admission, that is from shifting the patient from home to the hospital, and it can be intra-hospital setting, intra-hospital transfer to either radiology, that is it may be a chest X-ray or a CT scan, or it can be to the ICU from ward setting, or the patient can be stepped down from ICU to the ward. And when can we have an inter-hospital transfer? When we need a higher facility. That is, it can be from a COVID care center to a tertiary care hospital, or unfortunately, it can be a mortuary transfer where our patients have lost their lives and they need to be transferred to a mortuary. So what are the basic requirements while transporting the patients from one place to another? We need to have a dedicated COVID ambulance which has all the precautions which are followed and have adequate measures with which it can be sanitized, and strict adherence to decontamination protocols, and transport staff are all the time wearing PPE while handling the COVID patients. They are trained enough in identifying danger signs to stabilize the patient quickly, and they adhere to infection control practices. So when the patients are transferred from one place to another, we have to ensure that they wear a mask at all time if they are not intubated. What should we take care while transferring the patient from one place to another? Maybe a pre-hospital transfer or a inter-hospital transfer. So before transfer, ensure that all the staff are in PPE. Assess the condition of the patient, that is whether the patient is conscious, oriented, or it may be the patient is drowsy and is not responding to the oral commands, not moving his legs. Please record all these things, including the vitals, which are very important: pulse, blood pressure, temperature, and respiratory rate with saturation, which is very, very important. And ensure the availability of adequate PPE for the patient. Here what we mean is that the patient is wearing a good quality mask, and contact the identified healthcare facility for readiness so that they are completely ready and on board to receive the patient as soon as the patient arrives the hospital setting. So on board, that is while transferring the patient in the ambulance, measure the vitals and ensure the stability throughout the transport of the patient from the place of receival to the place where the patient is shifted, and provide supplementary oxygen to reach a target saturation of more than 90%. Follow ventilator management protocols if the patient is intubated and is transferred with tube to another hospital. So these are things which we have to follow in the ambulance. And what should we do while handing over the patient? So while handing over the patient, explain in detail to the place which is receiving the patient with complete history and the health status of the patient, and give details of any medical interventions if carried out in the ambulance. So what level of PPE is supposed to be used by transport staff? Coming to the driver of the ambulance is at a low risk because he is sitting in the front and not exposed much to the patient's secretions and infection. So he can use a surgical mask and a glove. And to the staff or patients who are patients attenders who are with the with patients who are spontaneously breathing are at a moderate risk, so they need to use N95 mask and gloves. If patient is intubated and being ventilated, it is an aerosol generating procedure or aerosol generating situation which is high risk, and full PPE should be used. So if aerosol generating procedures are anticipated, that is nebulization or immediate secretions, suctioning of the secretions, please ensure complete PPE is worn by the healthcare staff. Patient transport can be within the hospital, that is intra-hospital transport, or inter-hospital transport, where the patient is transported from one hospital to another hospital. Intra-hospital transport are in two situations. That is when a patient is shifted from emergency room or a routine ward to a critical care, that is ICU, when he is deteriorating, or the patient is transported for radiology scans like chest x-ray, ultrasound or CT thorax. But as much as possible, this needs to be minimized and bedside investigations should be encouraged. Inter-hospital transport is when the patient requires advanced ICU services in requirement for ECMO, and when the patient is deteriorating fast and needs to be transferred early to a advanced ICU care. To make sure that the patient is safe, we need to assess the need for intubation prior to transport, and the patient should be accompanied by at least a doctor and a nurse. Continuous monitoring of blood pressure, pulse rate, pulse oximetry and EtCO2 if the patient is intubated, and a transport defibrillator should be carried along all the time when the patient is transported, may it be within the hospital or to a different hospital. While transporting the patient from one place to another, the transport staff should make sure that they are safe from the exposure to COVID. So they are supposed to wear a N95 mask and complete PPE while transporting patients, and avoid using open breathing circuits or had HEPA filters. And when the patient is taken to scans inside the hospital, we should make sure that the scans are performed at the end of the day as much as possible to allow for terminal cleaning of the radiology room. So this is while transporting patients within the hospital. What should we do while transporting the patient in to a separate hospital? So ensuring a N95 mask and PPE is as usual, and we have to add HEPA filters to the endotracheal tubes if bagging is required via bag-mal mask ventilation or an ambu bag, and to add a HEPA filter to expiratory limb of breathing circuit if the patient is intubated intubated and on ventilator, and to open all the windows of the ambulance so that adequate ventilation is ensured inside the ambulance and the viral load is not increasing in the ambulance. The bystanders should be given a pre-planned dedicated transport route to which the patient is being transported, and they should wear a N95 mask or a well-fitted surgical mask throughout the transport. Rescue and contingency plans during transport. Before even transporting the patient, we need to assess the requirement for intubation. The patient might need intubation at any point of time, and that needs to be assessed, and as much as possible we should avoid emergency intubation, as that generates a lot of aerosols and aerosols which can be harmful to people who are transporting. Intubation is best done in ICU settings, that is under controlled settings, with intubating physician wearing a N95 mask and a level 3 PPE. While transporting, always prepare the equipments and necessary drugs in anticipation of medical emergencies like a sudden cardiovascular collapse, that is cardiac arrest, or hypotension. Gentle bagging by bag valve mask or a ambu bag to reduce aerosolization in the event of worsening or hypoxemia should be followed. Very gentle bagging. If you do aggressive bagging, again there is aerosolization. So bag valve mask should be fitted with a HEPA filter if used. After the patient has reached the destination, that is to a dedicated hospital which the patient was being transferred to, or to dedicated place where like scan rooms or to the ICUs, the transit zone should be decontaminated. And to do this, there should be a dedicated housekeeping team who are in PPE, who perform terminal cleaning of the route and the elevator after transport. Staff should doff the PPE appropriately after transport, and if a return journey is anticipated, they should don new PPE prior to embarking on the same ambulance and doff the PPE in nearest clinical area upon arrival. Terminal cleaning of the ambulance after arrival to the primary hospital is to be carried out by the dedicated housekeeping team. With this, we come to the end of session on infection control and safe transport. I hope it has given you some idea about infection control and the necessary precautions to be followed while the patient is transported from one place to another. Also, make sure that you see the donning and doffing videos, and the links are provided in the YouTube channel. So please go through those two videos for appropriate donning and doffing methods to be followed while doing duties. So thank you so much.